In episode 6 of Between Service and Science, we are speaking with Dr. Ken Ramos about military-related research in general. Dr. Ramos is a physician scientist internationally recognized for his work in genomics, precision medicine, environmental health, and toxicology. A member of the National Academy of Medicine and associate of the National Academy of Sciences, he leads the Texas A&M Institute of Biosciences and Technology. He is also chair of the Research Advisory Committee on Gulf War Veterans Illnesses. Dr. Ramos's leadership in veteran-focused research has advanced understanding of Gulf War illness, the health effects of Agent Orange, intergenerational effects of military exposures, and other military-related health concerns. Welcome, Dr. Ken Ramos, and thank you very much for joining the Between Service and Science podcast.
Good to be here with you, Dr. Halber.
As a researcher and a thought leader in the health concerns of military service members and veterans, what are you most worried about?
In reflecting about your question, I would say there's 3 areas that I think we need to be paying particular attention to. One would be mental illness and the mental health crisis that, of course, does not only affect the veterans and military families, but the rest of the nation. A second area, I think, of priority that I think we need to identify is sort of the biological underpinnings of chronic illness. Not so much in the context of the conditions that we know, are prevalent, in society, but in the case of veterans and military families, what contributions occupational exposures might actually have to compound the chronicity of illness. How much of a contribution that your past exposures make to that chronicity of illness. And then the last point relates to intergenerational effects. I think it's a major problem for society in general, how chemicals in the environment, how the things we eat, how the things we do impact the health of the unborn.
Dr. Ramos, those are some very big challenges. Are there any lower hanging fruit that we should be exploring first in terms of those mental illness foundations of chronic illness and intergenerational effects?
I think for all of them, there's short-term, interventions that can be put in place to begin to tackle the problem. Not certainly remedy the problem in full, but to have an impact, positive impact. So I'll take them, each one of them. For mental illness, I think lots of interventions related to PTSD are now being put in place. A lot of integrative medicine approaches are actually being successfully also deployed to be able to help veterans and other people, dealing with PTSD-related issues. The best example of it, of course, coming from the recent COVID pandemic, where a lot of people actually ended up, with stress-related disorders. So that's a good example of something that could be done now to actually, begin to remedy and address the health problem. With regards to chronicity of illness, I'm a pulmonologist with a clinical background, so a lot of what I think about relates to lung health. In that space, I think a lot of new discoveries are being made in the context of immunology and how you could help regulate the immune system in ways that actually minimizes the negative consequences of exposures on lung-related outcomes, and lung function.
So this idea would be that perhaps by modulating the body's response to some of these negative impacts, you could actually either slow the progression, the decline of the lung function, not necessarily reverse it, but at least mitigate the negative impacts.
Exactly. Okay. And then in the context of intergenerational, effects, of course, there's a lot more, I think, that needs to be done to really begin to tackle, that particular problem, mainly because we do not understand yet what's referred to as epigenetic inheritance. What that means is inherited traits not coming from DNA itself, but from the proteins that associate with DNA and the way that the DNA is regulated. So those are 3 ways that I think we might be able to begin to have some impact.
Do you think we have the right ingredients to move these things forward?
In some ways, yes. And in some ways, of course, there's still room, for improvement. There's funding mechanisms that are actually in place that can actually be deployed to be able to answer some of these questions and actually make them accessible, to clinicians, to practitioners, and people that actually work, with these populations. And those, I think, are resources that have been used effectively, for the most part. However, that we always struggle to really, make it, in full, develop in full. And what I mean by that is scientific discovery and medical research has advanced to the point that there's no one person that could actually do what that needs to be done to actually carry out things to full execution. You need to create teams, to assemble teams. And I think our ability to work in teams is something that we actually need to learn to do better than what we've done in the past.
Gene expression in the next generation, right? That's a very different skill set from running a randomized controlled trial of transcranial magnetic stimulation in patients with PTSD. It's almost like you couldn't even have one team, right? I mean, it's like you kind of need multiple teams that specialize along this pathway to making a difference. Where is the community voice in this process? Like, where can a veteran or veterans in general kind of engage in this discussion?
Stakeholder engagement is an absolute necessity to anything that we do. Ultimately, end recipients and users are going to be the ones that really will drive the engine. From my perspective, I would say that reverse engineering a scientific problem is probably the way to do it. And what I mean by that is that rather than beginning from the molecule or beginning with the fundamental biological question or chemical question or physical question that's being asked, what we should do is start at the very end with the problem and the people who suffer from the problem and the people who are impacted by this problem and work your way backwards in a way that I think enables the community to see the real value of what you're attempting to do because they're walking that journey with you. And at the same time, utilize the expertise that different team members into the research project make in being able to reverse engineer the problem to find the solution to the problem. Now, not all problems can be reverse engineered because in some instances, you don't understand the problem enough to even recognize that there is a problem. And that's where fundamental research, starting at the beginning, becomes, useful.
Speaking of a little bit about impact of science and, this challenge about getting scientific discoveries into clinical practice. Any good examples of how we can move things into, move innovation into actual clinical practice?
An area where I think the scientific community has failed, and where we need to put more intentional, thoughtful action plans in place is explaining better what the value of discovery research is. And I think we could sum up impact in probably one very quick sentence, and that is knowledge without action is really only a promise, right? It's really only a potential that you put in front of people, and people don't benefit from potentials. We need to find mechanisms, strategies, and ways in which those discoveries can actually be taken into the field, that they can actually be taken into the clinic, that they can actually be taken into society, that policymakers can actually use that information to draw policy, that when there's a crisis like COVID, we could mobilize that information to actually use it to respond to the emergency that presents, in front of us.
So, Dr. Ramos, what opportunities are there, or can you think of some good examples of engaging the community in these discussions about research and research priorities and sharing research findings with veterans, for example? Any ideas of how we do it now, how we do it well now, and maybe things that we could build on?
Indeed, there's plenty of opportunities, for us to continue to grow, our ecosystem in ways that enable progress, and that facilitate the conversations that need to happen for us to be able to start making a dent in some of these problems. Currently, I think one of the perhaps most successful ways that is done is the creation of standing national committees assembled, by either federal or state agencies, by universities, by private foundations, to essentially bring together stakeholders, different sets of expertise, different sets of viewpoints, different experiences, to be able to tackle a common problem. I think the outcomes from those efforts, I think, need to be disseminated in ways that allow others that did not have a chance to participate to be able to engage in multiple ways. I think social media is something that we need to learn to use more effectively.
Yeah, I think sometimes the long-term timeline and the incremental progress of science can be a little bit challenging to get people excited about, right? It's not the clickbait that people get that little rush from when they open their social media platform. So I think that's an inherent challenge, but maybe one that we could work on, as a community to figure out how to do it better.
A lot of what you do today really will not prove valuable until 20 years down the road. And that's a long lag time, for people to wait. The only resource that you have is to actually speak of the promise. And then people get tired of hearing of the promise, especially when the promise doesn't come, to fruition. But maybe there's a comfortable medium. Maybe my analogy of reverse engineering a problem might not be bad, in that you could reverse engineer the problem and then start from that point the education process and then walk the journey with people.
Well, Dr. Ramos, I think this has been wonderful. Thank you very much for your deep thinking in this area and sharing your thoughts with us on this podcast today.
Thanks for the opportunity. I've enjoyed myself, and I wish you luck in doing what you're doing. It's great service, I think, for veterans and for military families as well.
Thank you. This podcast is developed in collaboration with the Gulf Coast Center for Precision Environmental Health, and we appreciate their support. Thanks for listening. Let's keep searching for answers between service and science.